Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I will be demonstrating the self-myofascial release and muscle energy techniques for the Latissimus Dorsi, or LAT. So for the ground techniques, you are going to need either a smaller medicine ball that has preferably a little bit of give, or a lacrosse ball and a flat surface to lie down on. For the wall techniques, you are going to need a lacrosse ball and a flat surface that you can lean into the lacrosse ball with. The Latissimus dorsi, or lat, is a back muscle that attaches to the fascia at the pelvis and lumbar spine, some of the spinous processes of the lumbar and thoracic vertebrae, and then travels superior or up and laterally, passing through the armpit, wrapping around and attaching to the upper part of the humerus. When the Latissimus dorsi is dysfunctional, it can cause internal rotation of the humerus and shoulder, as well as depression of the shoulder and clavicle. So for the wall technique, we are going to take the lacrosse ball and we are going to put the lacrosse ball at the base of the outside portion of the shoulder blade, kind of into this meaty area of muscle in the armpit. So I'm going to start by placing the ball right in here, and then I'm going to lean into the ball, and I'm going to look for the first trigger point, or that painful nodule near the small attachment with the shoulder blade. So to achieve the ischemic compression portion of this technique, once I've located the trigger point, I'm going to lean into it with the ball for 20 to 30 seconds, and I'm going to wait for the intensity of the discomfort to decrease just a little bit. Once that discomfort has begun to decrease, I'm going to change the angle of the ball slightly, trying to find another more painful angle on the same trigger point or a trigger point next to it. Right? And then once I've found a new angle that's uncomfortable, again, I'm going to provide force through the ball into that painful tender area until the tenderness or discomfort decreases. Right, so I'm going to search for 3 to 4 of these trigger points through that thicker area of muscle that you can pincer compress with your fingers and your thumb and kind of pull away from the body and the armpit area. When conducting this technique, you want to stay on the muscle area of the ribs. And you want to try to avoid applying direct pressure to the ribs that don't have a lot of muscle mass on them. Right? So now, once we've located 3 to 4 of these trigger points, or these tender areas, and we've leaned into them for 20 to 30 seconds, we should have leaned into the fascia in the area for about 1 to 2 minutes, which will help us to achieve the myofascial release component of this technique. So for the floor technique, I'm going to use the smaller medicine ball because it has a little bit of give. You can choose to use the lacrosse ball if you want to. It'll just be more intense because there will be more force delivered into the area just based upon your body weight as you lay on top of the ball. So I'm going to place the ball on the floor and then lay sideline on the ball, so that the ball is pushing into that meaty area that I was talking about while we were doing the wall technique. You can bring the backside leg, or the leg that's on top, over to pick the hip up and take or add more of your weight onto the ball through the area as needed. Similar to all of the other ischemic compression techniques, I'm going to look for the tender areas or the trigger points within the same kind of meatier area of the upper ribs, being sure not to lay on the ball on the lower ribs that have less muscle than the upper portion. Once I find the tender areas, I'm going to lean into them for 20 to 30 seconds or until they become less intense. And then we're going to move the ball some and find another area that is tender or uncomfortable. I'm going to lay in this one for 20 to 30 seconds, and we're going to try to find 3 to 4 of them so that we can provide force into the fascia with the ball for 1 to 2 minutes. That way we achieve the myofascial release component of this technique. For the muscle energy component of this technique, we are going to take the arm on the affected side and we are going to bring it with the palm facing forward behind the head and neck area, just as far as you can go, provided there's no restriction or pain in the shoulder. So we're going to take the free hand and grasp the back of the elbow, and we're going to lean away from the affected lat. So once we get to the barrier, we're gonna hold this barrier for about 10 seconds. And once we've reached that time, I'm going to both flex the trunk back to neutral while pulling the elbow back down towards the side of the body at the same time with about 15% of my strength for about 5 seconds. After 5 seconds has elapsed, I'm going to relax for about a second and then pull the latissimus dorsi to the next barrier. I'm gonna hold this new barrier for about 10 seconds and then repeat the cycle 4 to 5 times.